is Jurimwa Wellness Consultancy in Murera in Theta in Juja in Kiambu in Kenya. Kenya is in East Africa, this is in Africa. And today I just want to ask to hear something different from what we used to look about schizophrenia. Today we will look something else called pain disorder and understanding of pain disorder. I know all of us, we have one day experienced pain. So now that is where we are today. The assessment of pain disorder can be made when a person's predominant clinical complaints is pain. That is the predominant focus of clinical attentions, and when psychological factors that may play a significant role in causing or maintaining the pain are present. This disorder has been known by a number of different names in the past, including somatoform pain disorder, psychogenic pain disorder, idiopathic pain disorder, and atypical pain disorder. Pain disorder is assessed when both psychological and medical factors are present. For example, when someone sustains head injury, they may suffer from excessive pain and seek a disproportionate amount of medical treatment. Sometimes pain disorders are diagnosed only on the basis of psychological features identified by history, evidence of past somatization, prominent guilt, or a history of physical or emotional abuse by either a parent or a spouse. However, these soft findings, together with the negative laboratory or physical findings, do not automatically imply that the pain presented is attributable to psychosocial factors. To make the assessment, pain must occur in one or more anatomic sites, with psychological factors believed to play a very important role in its etiology. The defining features is the preoccupation with pain that cannot be accounted for by any known medical or neurological conditions. Pain disorder shares a noteworthy features with confusion disorder, in that both are the only two conditions noted in the DSM-4 whose criteria requires an assessment for those interpersonal factors playing an important role in the development or maintenance of symptoms. This can be problematic because it becomes purely subjective. That is, what may be important to one practitioner may seem irrelevant to another. A second problem is that pain is also subjective and difficult to measure with any validity. It is commonly agreed that people experience pain differently. For that reason, it becomes important for the practitioner to separate out emotional reactions associated with chronic or excruciating pain through the competency-based assessment. Pain disorder can occur at any time, but most often it becomes apparent during adolescence or early adulthood. Symptoms usually emerge after unexpected acute stressor, and they can last weeks or months. Those symptoms generally subside after the initial stress disappears. However, because of effusions or unsupported secondary gain, the pain might persist long after the tension had diminished, or it might worsen under stress and continue to persist indefinitely. These persons are known to physicians shop, undergo unnecessary examination, procedures, and tests, become ingrained in maintaining the sick low, restricts their social and occupational functioning, often because they are bedridden and abuse medications, especially analgesics. The sick law was first examined by a person who suggested that the process of being sick helped to release individuals from their usual personal and family obligations while also absolving them from any blame for their sick conditions. The sick law also functioned as a way to obtain love, punishment for failures, a way to compensate for guilt or atonement for an intimate sense of badness. While pain can assume many forms, it is most frequently manifested in three major areas: the head, pelvis, and lower back. While pain can assume many forms, it is most frequently manifested in three major areas: the head, pelvis, and lower back. The pain presented can be evidenced through post-traumatic, neuropathic disease of nerves, neurological or surgical or medical treatment. Pain complaints are the chief reasons motivating people to seek out medical attention. While some people can grin and bear their pain, others can become severely immobilized and incapacitated. Pain disorders is a fairly common condition among the adult population in the United States. Estimates are that between 15 and 33% of individuals aged 25 to 74 suffer from some form of chronic musculoskeletal pain. Calculated that both the direct and indirect cost of pain medication in the United States amount to somewhere in the neighborhood. The Americans alone consume as much as 20 million pounds of aspirins annually. That is all what we have about understanding pain disorder. Nobody who can like to feel pain, but as long we are born, as long we are in this world, sometimes we have to suffer pain. There's nobody who can like to have pain because it's something it cuts all of you, it reduces all of your happiness, your joy, and mostly you see as if you are deserted by everyone. Sometimes you think a lot, you think there's something wrong you have done to God, you think there are some things you have not done in your home, you think you are cast by someone, but I can tell you no. Pain, as long we are living this world, we have to experience these things. These are not things which we can run away from, because it's not something which knock at your door and say, today I'm coming, so that, and then you refuse to open the door. It just come automatically. It's not something which you anticipate at today I will have pain, or I will have pain today and then it just goes. It's something which it can come, continue for a week, continue for a month, and even a longer time. Or what we have to know is that we have to seek medical advices, we have to pray, and we have to know it's just for a time and then it will go. Thank you. Please comment, subscribe, and like. Thank you.